that for the men, I'm not talking about the men, but I'll just chip in so that it's good to know you pay attention to it. And I know that there are men who are also part of that. So this is how it's also look like that. And it's also protect the bladder, the bowel. Now we have prostate in men. So that is I think the addition to it for the men. So we also carry, it's also a basin that also carry and then protect these organs from also coming down. Now for the men, it can be weakened by surgery for bladder or bowel problems. So when you do surgery, when they open you up, these muscles can actually be weakened. And I always say that when you have a phone and then you take it for it to be repaired, the moment they open it, the phone never comes back like that again. It's more like surgery. That is how it is. The moment you are being opened, it's not everything. It's we are trying to fix it, but you don't get into the original state. Hey, I forgot that I'm supposed to be mixing chi. Oh, okay, cool. So constipation Ghana chi kasim mechanism. Asa ope so or toilet by but also you meeting that's constipation. Then being overweight is very important in man, and so you should pay attention to this one. Persistent heavy lifting. This is for those who go to the gym and those who do mountain time in Yaman Kasia, those who do the heavy lifting at work and all of that. This can also weaken the muscles. Long-term persistent cough is very important. So you'll be out, puho, be it can also have an impact. And a smoker's cough, a smoker's cough and a bronchitis, these are lung conditions which can also weaken the muscles. And a wound, so when you are growing, it's also what's it called? It can also weaken the muscles. All right, so that is it for the men. Let's go back to my people. That's the women. Why this matters? Okay. Your hormones can make your ligaments and tissues softer as you grow. We have been talking about this, and I always say that in women, when you grow, like some of these hormones cause a lot. It causes a lot of changes in your body, from having your what's it called? Your menstruation, getting pregnant, and also menopausal stage. The hormones is a very big part of the woman's body, and it fluctuates, it changes, and it causes a lot to the body. So what you need to know that hormones can make your ligaments and tissues softer, and when these become soft, they are not able to hold the weight that is coming on it. Baby's weight pushes down every day for 9 months. So you know how pregnancy start. You start from what's it called? From a very small bump, then it start growing. But when it's growing, it's actually going down because at the end of the day, at the end of the pregnancy, the goal is what? The child is supposed to come out. So it will push these organs down. The birth process itself, stretching, it stretches your body. So you can chim and you are doing the and all of that. You are stretching those muscles, and sometimes it can lead to tears, it can lead to nerve injuries. Sometimes people will think that cesarean section is safe, but then the pregnancy itself will weaken the pelvic floor no matter what you do. So we really need to pay attention to this. My presentation today is very, very short. I'm just all right. Signs of a weak pelvic floor. Peeing a little when you cough. So there are some people, if you don't know, when they cough, they pee. When they laugh, they pee. And when they run, they pee. These are signs of what's it called, weak pelvic floor. They feel this heaviness or something wants to come down out of their vagina. That's a sign of a weak pelvic floor. Um, Passing when accidentally or difficult controlling bowel movement. Passing when no is should I use the word fatten? Is that the right word to? Yes. So that is it. Um, Pain during sex, it's very important. You start to feel pain during sex because um, when it drops like that and you are having sex, we know how intercourse goes. So the man probably will be hitting. When I know some people play with you are touching my womb and then all of that. That one is different, but this one is more or less like when it's weekends or you start having sex and then you start having pains and you experience some of these signs that I've also mentioned earlier on, you can be suspecting weak pelvic floor. Aside that, pain during sex can be due to so many factors. So when you go to the hospital, they will check it and they will let you know what it is. But if you see anything of that sort, it doesn't mean that it's a weak pelvic floor. It can be anything. That is for the pain during sex aspect. Now, lower back or pelvic pain sometimes are linked to these things because, like I said, it sits on the basin is it's under the lower the spine. So one way or the other, because they are linked together, you can start having some pelvic pain and lower back. Um, Complication, if this is ignored, it can lead to prolapse. Prolapse is when the organs that we spoke about, I'll go back and show you the picture. These organs tends to come out. Long term can lead to urine leakage, bowel issues, and intimacy problems, like I've already mentioned. It will affect confidence, your mental health, and your quality of life. What do I mean by your confidence? I mean, if you, let's say you cough and then you pee, you might probably saw yourself or um yeah, your mental health, you'll be worried, you'll be thinking about it. What is the problem? What is the solution to this? And then this is not how you were. What happened to this? And then all of that can put a strain on your mental health, your quality of life too. You can't run. If let's say you're a runner, you laugh a lot. But this time around, you can't even laugh a lot just because you have a weak pelvic floor, and it will end up you might end up doing peeing on yourself. So I'm going to go back to the picture again and then show you what can actually come out of the vagina. The bladder can come out, the uterus can come out, the bowel can come out. So these are the things that can actually come out. So the moment they come out, they drop. That is what we call the prolapse. So these are types of prolapse that we have. Normal anatomy, this is how it's supposed to look like. So this is where the bladder is. This is how the bladder looks like. The uterus and the rectum, that is the bowel. So if you know your anatomy very well, you realize that when you get pregnant, this uterus expands. So already it's even putting pressure on the bladder. It's also expanded and start pushing the rectum backwards. But in the case where the pelvic muscles is very weak, you realize that these things will drop. They can drop. So we have the bladder dropping down to the vagina, and you can probably they are in stages, and depending on the stage that you find yourself, I mean, there are times where you can actually see it very well. Also, we have what is the next one? The what's it called? The rectum also coming down. It's also possible. So this is how it also looks like. These ones will be fine, and you realize that the rectum descends. Then we have the womb itself. That is the uterus also coming down. Um, what can you do? These are some practical steps. There's something that we call the Kegel exercise, pelvic floor exercise. Imagine trying to stop yourself from peeing or passing when that's the muzzle. You can try it right now, but please make sure you don't pee on yourself if you are not too family. But anyway, you just imagine yourself from peeing or passing away. That thing that you feel like that's your pelvic floor muscle. The the sensation you get inside, that is the muscles trying to that's the muscles working. So you squeeze, hold for 5 seconds, relax for 5 seconds. You repeat this 10 times, 3 times a day. I'm going to show a video, so I'm just reading this out and we'll just look at the video and then you understand. Mix short squeezes, quick flicks, and long holds. I mean, the women normally do better with these things, but we the men, we can't even hold it. The moment you start, you can't stop it. You just have to. The moment, but there are some people who are able to stop it, but some of us we are not able to hold it like that. The moment it gives the go ahead, we just want to empty everything. So you can do these whilst you are brushing your teeth, cooking, or even at traffic light. I don't know why they mentioned traffic light, but yes, okay, traffic light. You stay active, walk, swimming, pregnancy safe exercise. When you go for ANC, they have these exercises. I came across a video. This nurse, who is also a doctor, and yeah, is he a midwife? I think a midwife. He's a dancer. So I think they do these exercise and teach these pregnant women how to dance. All these are pregnancy safe exercise. But yeah, when you meet your GP, your doctor, or whoever is taking care of you, they will teach you one or two. Prevent constipation, drink a lot of water, eat fruits, veggies, and fiber. Um, what? Straining weakens the pelvic floor. Oh, today when I was doing this eat fruit, I had blend some watermelon bit that I said I'll put beside me. So when I'm talking, I'll be drinking. So people will know that we don't play with our when we talk about nutrition. But anyway, it's all good. I forgot it's in the fridge. Anyway, lift safely. When you are lifting, bend your knees, keep your back straight, and exhale as you lift. I know that the old age, normally when they go down, they are not able to come up, but it's something that you really need to learn how to do. Bend your knees, keep your back straight, exhale as you lift. And also we have physiotherapists, pelvic floor specialists that can teach you tailored exercises, and these are very important things that when you meet your what's it called, your GP or your doctors, they will be able to teach you one or two, or they will actually assign you to a physiotherapist. All right, so let's move to the video.
How to do pelvic floor exercise.
Sorry, Abna, can you hear the what's it called? The audio.
The pelvic floor is a group of muscles and ligaments that surround the openings at the bottom of the pelvis. If your pelvic floor muscles aren't working well, then you may have leakage from your bladder or bowel, or find it hard to empty them. You may also find that you need to get to the toilet in a hurry, or that you constantly need to go to the toilet. Pelvic floor exercises help strengthen the muscles around your bladder, bottom, vagina, or penis. This can help with bladder control and also help treat pelvic organ prolapse, which is where one or more of the organs in the pelvis slip out of their usual position. Strengthening your pelvic floor muscles can also help increase vaginal sensitivity during sex and can reduce the symptoms of erectile dysfunction. If you're pregnant or planning to get pregnant, pelvic floor exercises can help lower your chance of leaking from your bladder or bowel after having your baby. Anyone can do pelvic floor exercises anywhere, whether sitting or standing. To do pelvic floor exercises, breathe normally and relax. Squeeze the muscles around and in between your back passage and bladder. Lift up as if stopping yourself from passing wind and peeing at the same time. Count to a couple of seconds and then relax. Make sure not to do pelvic floor exercises whilst you are peeing, as this could be harmful to your bladder. Do not hold your breath or tighten your stomach or thigh muscles when you're doing the exercises. When you get used to doing the short squeezes, you can try longer holds as well. To strengthen your pelvic floor muscles, you need to have a routine that mixes slow and fast squeezes. Aim to gradually increase the length of the squeeze holds to 10 seconds, repeating this 10 times in addition to doing 10 fast squeezes. You should try and do pelvic floor exercises at least 3 times a day. Every week you can add more squeezes, but always have a rest in between each squeeze. You should start to notice improvement in your pelvic floor function after a few months. Improvements could include having better control of your bladder and bowel. To help maintain your pelvic floor strength, just keep on doing your pelvic floor exercises. If you are unable to feel a squeeze, then letting go of the muscles Or if you experience pain while doing these exercises, then see your GP to ask for a referral to see a pelvic health physiotherapist.
All right.
How to do.
Thank you very much. That's me over here. Very nice image of me. That's a very long time image. It's very nice, yeah, Abla?
And you should create one for me. I want one. Is that that's so...
Anyway,
Wait, you designed it yourself?
no, someone did it for me
Okay.
years ago. Yeah. Anyway, yeah, so that is it about pelvic floor health, and I hope you learned something. So Abna, I'll hand over to you.
Thank you, Dr. Kojo. Yes, that was indeed a very, very short, if anything, a very short presentation, yet still packed with quite a lot of if anything, information. So thank you very much, Dr. Kojo, and welcome. We are very glad. Oh wait, there's already a hands up. We will go on a quick commercial break, and when we're back, we'll take questions. As there are already hands up, let's go quickly and come back quickly. So please hold on for a minute. Thank you.
Join the Ghanaian Doctors and Dentists Association United Kingdom for our annual flagship health conference and fundraising gala, bringing together healthcare professionals of Ghanaian and African heritage across the United Kingdom and Ghana to share insights, build networks, and advance community health. Join us on Saturday, the 11th of October 2025 at Hotel La Tour, Milton Keynes, situated in the heart of Buckinghamshire, featuring panoramic views of the beautiful Campbell Park. A perfect setting for a day of learning and an evening of celebration. Our daytime conference theme will be Advancing Community Health, Primary Care Perspectives from Ghana and the UK. We have special invited speakers and CPD points are available for the daytime conference. And as the sun sets over Campbell Park, join us for a celebratory gala evening filled with culture, connection and purpose. The night will feature a formal dinner, entertainment and opportunity to support GDDA UK's ongoing health and educational initiatives in Ghanaian communities. We will launch our Legacy Awards for outstanding contribution to healthcare in the Ghanaian community. Early bird tickets are available now on Eventbrite. We look forward to seeing you there.
Hello, and welcome all. Welcome back to the OT Health Talk Show. So, if you just joined us today, we've had Dr. Kojo back after a long break, and he talked to us about pelvic floor health. And so now we are at the second section of our show, which is the Q&A session. So at this point, we will be welcoming questions from our audiences. And just to remind you that you can ask questions on today's topic, or you can ask questions on any sort of health topic any health topic or concerns or query that you have. So without further ado, I saw that Planaria's hand was up first. I just want to confirm that your hand is down before I give the opportunity, before I move on.
I said I want one of the animation that Dr. Kojo has, please. Thank you.
Okay, thank you very much, Dr. Akos. Thank you, Dr. Thank you, Dr. Akos, on your day off for joining. Okay, then we'll move on swiftly to Doctor another Doctor Mustafa. Please go ahead.
Thank you. I just want to say it's quite interesting that.
Oh, is it me or have we lost
Yeah,
Doctor?
I wanted to say that it's quite interesting that. Hello, can you hear me now?
Yes.
Yes. Yeah, I wanted to say that it's quite interesting that could you be topics I will be choose to be a diabolism, kakra, diabolism. Anyways, our pelvic floor exercise. I didn't see the video quite well, but could you was it about did you talk about Kegel exercise and so on?
Yep. I did mention Kegel exercise. I think what I
Mhm.
was going to I just read through, then I was going to tell if you want to see it because they have a proper ways that they do like different exercises, like how the animated or the video, how you go through it. Because even this one, they actually zoomed into the pelvis itself, and then they were just showing the muscles how you're supposed to do it. But
Okay.
there are
Yeah.
different videos.
So my question is that um do some of these exercises help in sexual life and so on? Like, does it help for men and women, or it is better for women than men? Like, can you just throw more light to it about pelvic floor health plus sexual health? Thank you.
All right, great. I really love sexual health. It's one of my favorite topics. Anyway, yes, it does. Normally, for a man, you want to try as much as possible to get enough blood flow from your lower body so that you can have a very good stamina. So it is advised that you need to exercise. Squats is very important to strengthen your muscles to improve blood flow. So when you go to the gym, it's necessary that you take care of your lower body. So don't miss leg day or lower body day. It's very, very important. So far as you are strengthening your muscles and you are having enough blood flow, it's a plus in your sexual health. When it comes to the women also, strengthening your muscles, it's necessary because so I was speaking about pregnancy. After pregnancy, when these muscles become loose, it's very important for you to start exercising for you to get them back together into a normal, should I say, formation. During sex, I don't know if it is safe to even say this here or whatever that it is. When you are having sex, touching the walls of the vagina is very, very like going. I don't know how to put it, Mustafa. You've put me. It is very important. It's not, I'm not talking about sexual health, but yes, it does improve, what's it called? Sex for women too, in as much as when I mentioned, I don't know when you were here, when I mentioned, what's it called, that you can be having pain during sex. These are due to the fact that these muscles are weak, so it does cause pain. But when you are able to do these exercises and then strengthen your muscles, it goes hand in hand for you, the man, and then also the woman. You are able to, grab the improve the, should I say, the tightness of, let me just say tightness of it. It's very important because when it becomes loose, you don't really feel it like that. But it's when you exercise, it will improve. Mustafa said the diplomacy for me. Exactly. I have to be very diplomatic and I don't want to be using certain words and then all of that. But anyway, yes. So far as the muscles are, they are strengthened, they improve with the tightness, and then you will enjoy your sex. So please do exercise. And when you go to the gym, try as much as possible to do lower body. People really don't like it because it is very, very painful. Those days are very painful when you are done and you are out, or when you do any exercise from your lower body, you feel it for days. But yes, it's very important for you to do that. It does improve in sexual health. Thank you, Mustafa. Doctor, don't put me on that spot again. I don't know the kind of people I'm seeing today. It's been a long time.
Thank you, doctors. Don't worry, your audience, you are pretty much the same. Just before we go on, there's a question in the chat. I just wanted to ask for those who don't particularly specifically go to the gym. I mean, gym culture is very popular, so obviously a lot of people, like when you talk about going to the gym, everybody knows what kind of exercises to do. But if you don't go to the gym, what kind of exercise can you do that focuses on like your lower body or the part that you said? Walking, is that good? Jogging?
Yeah, walking is good. Jogging is good. You can actually do squats at home. You don't need much to be squatting. You can break them into, let's say, 3 sets of 10, 20 reps, or you can start small. You just go 1, 2, 3, 4, 5, 10. Then you take like, let's say, a minute break, then you continue and then all that. It helps with your lower body. What else can you also do at home? Um, 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 there's this name. What else we do? I'll just look for it. I'll look for other exercises, and then yeah. But there are various exercises you can actually do at home. You don't have to go to the gym.
Okay, right. So just before, I think Janet is asked, well, it's more of a sort of addition to what you're saying. Am I correct in saying it strengthens the elasticity of the uterus as well?
Yep. Yes.
Yes. Okay. So we've got a question from Cecilia here, which is this Kegel exercise good for someone who has had fibroid surgery?
So yeah. Generally, yes. Pelvic floor exercises are safe and beneficial even after fibroid surgery. The thing is, after your surgery, you do have what's it called? These muscles are still loose in a way, so you need to try as much as possible to strengthen. I think let me borrow the word that the lady used, the elasticity and then all of that. But you have to consider certain things like timing. The time matters. The time that you did the surgery, it depends on the kind of surgery that you also did. So you have to give it some time, about I would say maybe 4 to 6 or 8 weeks. It's very important. And also start very slow. You don't have to just go in because you want to what's it called? Heal faster. No, you have to start gently so that your body would actually adapt to it. Most importantly, listen to your body. I don't know, I think when we started, I don't know whether it was Dr. Mustafa who used to say that you really have to listen to your body, and if you whatever the body is telling you, that's what you need to do. So in this case, if you feel pain, stop it. If you feel any pressure or anything of that sort, you have to stop it and then make sure that you give it ample time for it to heal before you get on. Mind you, when you do surgery, you have stitches, so you wouldn't want to do anything that's actually going to remove these stitches and then all of that. So yes, and consider physiotherapy. These are specialists. These are the ones who will be able to tell you do this, do that, and they will guide you through it. Yeah.
Excellent, thank you. I've got a question from a gentleman. Excellent. I love getting questions from men. With the whole drama about paracetamol and autism, what is your expert opinion on the fact that taking paracetamol during pregnancy causes autism? So I honestly don't believe this in my pocket doctor opinion. Other than that, majority of the population would have been autistic. Is there any half truth about noticeable side effects?
About paracetamol.
So taking paracetamol, well, there's an opinion that taking paracetamol while pregnant during pregnancy causes autism. So there's a link between paracetamol and autism.
I can't conclusively say that there's any evidence confirming that there's a link between autism and the use of paracetamol. I don't know. Probably Dr. Akos or Dr. Mustafa can probably step in, but I'm not aware of that.
Dr. Akos, go on. Hello, Dr. Akos.
Can you? I don't know. Is she on mute? Okay.
I muted
All
them.
right.
All right.
Can you guys
Yeah.
hear me? Oh, God.
Are you here?
Hello, can you hear me?
Yep.
Okay, yeah. So can I categorically state that I think this has been said several times this week that this is not true? So Trump, I'm not even going to dignify him with the word president, but Trump at the UN said that paracetamol causes autism. There's not been any scientific evidence whatsoever to prove that that is true. And to be honest, there's been so many like information out there from the NHS, from the UK, saying that those words that Trump used was not true. So no, paracetamol does not cause autism. Nobody needs to be worried about that. That is not true at all. So I just want to reassure everybody here that there is no link whatsoever to paracetamol causing autism. And I don't even know where Trump just got that from. Sometimes it's like he just wakes up and just makes stuff up. So yeah, I don't know, but it's not true.
Mhm.
Thank you, doctors, for that. We can all be reassured that paracetamol is safe to take. However, we should not abuse paracetamol, which we tend to do. So, okay, there's not much questions flowing in, but please do ask. Dr. Put your hand. If you could just put your hand down so that I don't get confused. Thank you. There are no questions coming in at the moment from our audiences, but as you speak, I normally tend to read around the topic a little bit. And there's been a mention of posture. So I just wanted to ask, does posture affect the pelvic floor as well? And if that's the case, what steps can we take to sort of improve posture, which it will in turn sort of improve our pelvic floor?
Okay, so it's more or less like putting pressure on the pelvic muscles, right? So your posture is very important. That's why I mentioned that even if you are lifting something, you need to get the posture right. When you go to the gym, you need to get your posture right. It is very important. You don't go and then just do whatever that you want to, else you'll be hurting yourself. You'll be causing musculoskeletal injury or injury to the muscles. And yes, it can weaken your what's it called? What's it called? Your pelvic floor muscles, which is something you really need to pay attention. It's something that we don't pay attention to, but I think it's good to know so that those who don't know. That's why I chipped in for the men and said something brief because the men might probably think that it doesn't concern them, but it does concern them too. You have to and one thing that I would say, when Dr. Mustafa chipped in sexual health, I want to state here, alcohol, smoking, and all of these things, right? Where I think people think that it's a booster to have, what's it called? To be able to have, I don't know the word to use, that it gives you this kind of booster for you to have sex or whatever that it is. It is not true. What you really need is to improve blood flow. So you need to whatever you can research on how to improve blood flow. These smoking and then these alcohol doesn't do that. They are just clogging the pathway. So you realize that to be able to last long, these are for the men, to be able to last long and to be able to, I don't know what they will say, whether to power or whatever that it is, improve your blood flow is going to improve on your erection and then all of that. Alcohol and whatever that it is really doesn't do much. So don't I think it's something out there where people believe that when they take in alcohol it does something, but please just exercise is very important and be taking food that will improve your blood flow. For example, watermelon, it's good to know, take it home.
Really, watermelon improves the blood. I didn't know this actually. This is quite interesting. And also about the pelvic floor. Funny, I only just found out that men have a pelvic floor as well. It's something we normally focus on the women, so it's actually this is why we do this show. This is great. I I also and oh, we've got hands up. I get excited. Anti-comfort, please go on.
Dr. Kodzo, thank you very much for your presentation and welcome back. Although Dr. Kodzo should also have been there, I've missed her face today. You should all show your faces. Okay, yeah, so I just want to say that if there's no contraindication, pelvic floor exercises could actually start during pregnancy. It doesn't have to wait until delivery. Then the mothers will be stronger, and ready for the delivery and everything. So it should start from pregnancy. The other thing is for those, most marriages, I think the problems are, if it's not money, it's sex. Yeah, if it's not money, it's sex. So, okay, someone showing their slide. Should I go on? Oh,
Please go on. Please go on. Please go on,
Yeah.
Auntie Comfort. Please go on. I think it's Dr. Kojo just probably getting it ready.
So if it's not money, it's about sex. And I'm glad you mentioned that, it improves sex drive, especially for the women. There are women who will tell you that they've had about 2 children, 3, they've even finished having their children, but they've never, ever enjoyed sex. I just want to reiterate that you are very right in saying that the pelvic floor, exercising your pelvic floor improves sex, in bed. So for the women, I would really encourage you to, it's for life. You don't do it and stop. It's for life. If you are cooking, if you are lying down, if you are talking, if we are gossiping, whatever activity you are doing, you can do pelvic floor exercise, and it's for life, and it will improve your sex life, and so doing, improve your marriage. Thank you.
Thank you, Auntie Comfort. I also wanted to ask more like, because Auntie Comfort, you said it can start from pregnancy. Can it even start before? Can you just be doing it, now, like as I sit here now, can I start Kegel exercises?
Yeah, actually, so I think, like he said, you don't even wait to get pregnant, or you should start right from, you should start doing, it should be part of you, like you exercise your hands, your muscles, you want to look well toned and so on. The pelvic floor must also be toned. So you don't even wait to get pregnant. You can start, you can do it. Unless there's a contraindication. For some reason, your gynecologist says that don't do it until a certain period. So if you get pregnant, then find out, is it okay for you to continue? But you must do it all the time. You don't wait to get pregnant. And if you are in your menopausal state, you are in your menopause, it doesn't mean this is not just for the young ones. It's also good for menopausal women, where the pelvic floor muscles are loose and they are leaking urine and so on. Do the pelvic floor muscle exercises and you'll be okay. Let me just chip in here that we had a case of a lady who is in her menopause, and her husband, and she kept having infection of the bladder. They will call it, the doctors will say cystitis, and then we don't know where she was going, but she was just taking antibiotics and so on. But we learned that when it was probed, it was realized that she will usually get it, after sex. They are in the UK here, but the husband, I think, is somewhere in the Wales and she is in London, so they don't meet all the time. And then upon probing, please, I just want to, it's not about infection control, but it's important that, we hold our phones all the time, and there are a lot of bacteria on the phones. I'm saying this because we did urine test. We sent it to the lab for culture and so on, and there was no infection. They said multitude of bacteria, but there was no, because they didn't do sensitivity and all that. So your phones, please, men, especially if you are going to have sex today, because most often unless, but if you are going to bed, wash your hands with soap and water before you touch the vagina area, please, because this is what has been found, that you play with your phones, and then if you transfer some bacteria to the vagina area. And then when they learned about it, the husband was very understanding and very apologetic to the wife. Now, since then, there hasn't been any more infection, because the husband has learned that, he has to be careful at the time of going to bed, using his phones and so on. So this is just something to chip in. This is a practical experience which happened. So please wash your hands with soap and water. Likewise, the ladies, if you like holding on to your husband's penis, wash your hands with soap and water, please. before you go to bed. If you know that, especially sometimes there are signs that it's going to happen that night. Make sure that your hands are clean. Thank you.
Thank you very much, Auntie Comfort. Dr. Kojo, this one there, this is in your lane. I wanted to ask, the more I learn about sexual health, the more I realize this spontaneity sex thing that, movies and things romanticize and tell us, it's not good because it seems like there has to be a lot of planning and hygienic preparation before you actually do the do. So you cannot just, this romantic meeting and just going in and all that thing, the way they romanticize it for us. It's not really practical, is it? Well, it shouldn't be. It's not healthy, is it?
I mean, it's not. I'm very big on hygiene, so um, those things will bring you problems later. I mean, sometimes you want to be wild and free, but when you get the infection, you'll be wild and suffer. Yeah.
Yeah, no, great. Also, there's a question in the chat, Sandra. I will get to it, please. I have not forgotten. It's just because I want before we move on from this particular one, and
Mm,
and then we can go on to Sandra's question. So you took it down, but you showed some Kegel exercises or exercise that help with I won't say Kegel help with pelvic floor exercises as the gym person that I am becoming.
mm,
I realized that there was like hip thrust and things like that. And
yeah.
now I recognize doing certain exercises like squats,
Mm,
hip thrust, and those things, it does force you to squeeze your bum
mm,
and those kind of things. So technically, doing those kind of glute exercises, does it in effect
yeah.
exercise the pelvic floor?
Yes, it does help a lot. I mean, the ones that I was showing was ones that you can actually do at home. So you don't need any equipment, you don't need anything. You just those ones are the one you can do at home. But anything for the lower body, especially when you are paying attention to your hip area, like you are saying, the hip thrust, the machines, I've forgotten the names of the machines that you use. All of these things actually help. So kudos to those who go to the gym. They are doing well.
We thank you for your recognition. Auntie Amma, no problem. I will let
Yeah.
you, I will unmute you after Sandra's question. That's fine. Okay, so Sandra's question here is, do you think it is better to have a C-section for fibroids to be removed during labor when one has fibroids, or if a woman can undergo a normal vaginal delivery?
Dr. Abena, can I answer that question, please?
Okay, that's why you wanted to. That's fine. Yes, you can.
Okay. Yeah. You can have a normal delivery if you've got a fibroid, and it's the safest, I will say, because with cesarean section there are quite a few complications. So I will say there are complications. So, if you've got fibroid and there's no I mean, there's no problems, you can have a normal delivery. I don't think you should go for opt out for cesarean section, because people don't really realize that when you have cesarean section, there's a lot of things which goes on whilst it's going on. They may even nip your bladder, some of your organs may be moved around, and there's quite a lot of implications. So I would just say, if there's no contraindication, or if there's no problems going on, please go ahead and have your normal delivery. Thank you.
All right. Thank you,
When I'm
Auntie Amma.
Dr. Akos, if you have, I said Dr. Akos, Dr. Kojo, if you have anything to add to it before I come in, please.
All right, cool. So I think it depends on every individual circumstance that you find yourself. So from experience, the ones that I have seen, what we do is that we have some factors that we actually consider. So we do anyone who has a fibroid, when you come, we do what we call the fibroid characteristics. We are looking at the size, the location, the number of fibroids that can actually increase the risk of complication during labor and then delivery. We are also looking at risk of uterine rupture, and then also we are looking at future fertility. So just like Auntie Amma said, these are some of the things that we actually look at. until you come to the hospital and then we assess you, your what was it called? Your obs and gynae specialist assess you and then tell you, because he's also there to guide you through your pregnancy, as I've started with the pregnancy series from beginning to the end. So if you have anything like that, they will sit down, they will plan, and then they will let you know what is actually good for you. So yes, it depends on individual circumstance. So in as much as it is good for you to know that you can go ahead and do it, I would advise that always make sure you see a specialist and let them tell you what is good for you, because every individual has a different circumstance that they find themselves. So that's what I had to.
Auntie Amma, would you like to come in?
Yes. Thank you, Dr. Kodzo Akwabapa. Fia ya feel nenya sem kitwa. Dr. Mustafa Akwaba. What I wanted to just add to what you said, I know sexual health has come true. It's a plea to the men that we heard that Auntie Comfort said, washing your hands before you go and touch sensitive areas and other things. I want the men to have it in their mind that men, because of more organ more it's not open, but a man, the slightest thing they get infection. Especially when you are using public toilets. What Auntie Comfort said, there are a series of things which especially some women when they are pregnant, throughout the pregnancy, won't be infections. And when you go, talk to them about hygiene and everything, the woman is doing it, to be. But at the end of the day, the men, because they are opening, they are they don't own infections there, but to say ma because our opening you wide it's baby to me HIV easily. Bema, it will take some time. Just a plea to the men, say anything you do, have your partner in mind. Say, toilet, jingle bell, no, if no one found to baby basa na kofa enye maybe I'm remano. That's what I wanted to add to it. And again, that's one of it. The second one is we are talking about premenopausal women with pelvic floor. Pelvic floor. No, I think we have to teach even our children to when you get to old age. It's very, very good. It's really helped me, but I got to a point now. Because of some medications, I know Dr. Kojo didn't touch on medication. There are some medications, a more weak bladder, especially some of the pain relief. Now, fun. And also, medications, no. So, you need to read the side effects and then be informed. Answer na wafa. That's what I wanted to add to it. Thank you.
Thank you very much, Auntie Amma. Dr. Kojo, any submissions? Anything you want to add to Auntie Amma's submissions?
Oh no, she has said everything.
Excellent, and I love it. Jingle bell, and it's quite seasonal. Christmas is coming. Yes. Sandra also just added says so after if you are the type who can have normal delivery with your friend is saying with your fibroids, that then after you can have the surgery to remove it after the childbirth, isn't it?
Even with that one, like before you even come for us to remove fibroids, we still have factors like is it necessary for us to remove it? Is it causing pain? Are you bleeding? All these things. Because I remember back in medical school, my surgery teacher always goes like, do whatever it takes so that you don't get opened. Because the moment, like that is the whole thing. When you take it to surgeons, they love to cut. They will cut you right now, and then some people even use it for experiment. Like they want to teach younger ones. So the moment you hear fiber, we are going to take, so they will just go open you up and then all of that. But it also depends, like what is it? we look at all these things and then before we take it out, because it's not, sometimes some people have been with it and it didn't really cause problems. So size, consistency, how the location, we consider all these things. So yes, you can actually remove it later on if there is a need for it.
Great, excellent. Oh, and Anti-Comfort's hands are up. Anti-Comfort, please go ahead.
Yeah, on fibroids, it's just to tell our audience, everyone, that the health professionals here are not saying that if you have fibroids, you have to get pregnant, have your baby before you remove them. Because sometimes the fibroids is even preventing you from getting pregnant anyway, or it's even causing spontaneous abortions and so on. So see your gynecologist, let them assess you, and then they will give you information as to whether you have to remove it before you try to get pregnant, or you can get pregnant with this type of fibroid and then remove it later. So I just wanted to throw a bit of caution.
Great, thank you, Anti-Comfort. I thought there was a question in there. Oh yes, no, yes, thank you, Sandra, for your question, and thank you, doctors, nurses, and all healthcare professionals. There was something I wanted to mention. Just as you were speaking, Dr. Kojo, you mentioned, you know, now when you were talking about, say, you have to see your healthcare professional before to see if you can a C-section is better for you, or no, Auntie Amma, when she was saying, she said to C-section, sometimes the things that can happen, the negative things that can happen, which kind of took me back a little bit. So I just thought perhaps at some point, can we have a topic on like the different delivery what's it called, options and like potential pros and cons, or what they can do to the body and what's good for what. And I thought because some of the things Auntie Emma was mentioning, this will be the first time I'm hearing the C-section can cause some of these things, which is
Listen, deliveries, no, I always say it's nyame na because you can have a normal delivery and have complications. Yeah, you can have normal deliveries. I've seen normal deliveries which ended up with women losing their lives, losing their uterus, and but people need to know the the side effect of each delivery. I mean, ventouse, forceps, ventouse. Although I'm a midwife, I would rather have a C-section than have a ventouse and a forceps. And the suction cap being a two alkalinity suture. And me in particular, no, I have a big about because of the implications, no. And some of the doctors, no, you see, they have a Dr. Kojo. I don't know how many pools in Miriafi, but I know there are a number of pools. The doctors be one person because it's the section. The one be ya ama actually instead of be a 3 and a 2, no, be more obey use section more than necessary. I think what Dr. Abna Awakano is very good. It's good say we educate the public, say these are the implications of every or of the choices. Cesarean section, I've had two cesarean section, and I can tell you it's got its side effects. I wish I could have but everyone is different, mine was just emergency C-section. It will be best that we will come one day and then talk about the different types of births and then what to do to help. Again, I would say C-section is on the increase. Seriously. C-section is on the increase. And first, now we thought, say, among Abrofono, among before, it is so bad. I haven't checked the ONS, that's Office of the National Statistics. I mean, check it recently, but the last time I checked, now it was high. And my colleagues now ward, say it's so much. Sometimes you go on the ward, almost everyone has had a C-section. say they can have 8 cesarean sections in a day, 10 cesarean sections in a day. It's too much. And again, I think say Dr. Abuna, it would be best say we have a time to educate the AE, and then things that people can do to help themselves during pregnancy, birth, and beyond. Thank you.
Thank you, Auntie Amma. And definitely, yes. And this is within Dr. Koju's sort of specialty, or interest, should I say. So we'll work with Dr. Koju to see a time with me about you can fit it into I think you're doing like a whole women's health, breastfeeding, pregnancy type of series. So you can definitely fit that into that. Dr. Mustafa, we can Auntie Liz cannot recognize, it's his name. He just has a lot of he's just using one of his names, which is Abdul Mumin. So yeah, but oh, okay. And sorry, I'm just scrolling and see some of these are on medical grounds. Yes. Okay, so we've got a question here. Are C-sections common because women are choosing not to push instead? Oh, that's a good an interesting perspective.
No, that's not. That's not. C-section can be due to various reasons. It can even be due to position of the baby if they are not able to get the baby the right position. It can be due to these fibroids that we're actually talking about. It can be due to a lot of things. So I think it's a good thing that you said that we'll talk about the different delivery options that we have. So I don't know, Zoom user, please do well to join us every Wednesday. I'm sure that one of these Wednesday I'll talk about the different delivery options. Then we understand that better. I'm doing a whole pregnancy series, so anything on pregnancy at all. If you like, just put it the topics, anything you want me to talk about, you can put it in there. So I put it in my diary and then talk about it later on. So yeah.
Absolutely. Just to reiterate, you can suggest topics that you want us to sort of like cover, and see if there's anything that you kind of want to hear, or you think we haven't covered, or you think we've missed, or you think we should do it again because, yeah, why not? Just let us know, and we will try and get that. Oh, well, fibroids from Dr. Mustafa. Dr. Mustafa, will you cover that yourself? I think so. So Dr. Mustafa has gladly offered himself
To talk
to
about
cover
I think I agree with that.
fibroids. So we will work behind the scenes to get your availability. Thank you so much, Dr. Mustafa.
Yep.
Yeah. Yes, so excellent. Okay. I I will any more questions? But anyway, this has been a great oh yes, questions. So we've got another question here. Do you think oh, yep, okay. Whoever wants to speak, please just raise your hand, and then when I'm done with Sandra's question, I can come to you. So, Doc, do you think DNA blood tests from chromosomal syndromes is accurate than amniocentesis? Hey, you people are testing my doctorate too. Amniocentesis, or just a preliminary test?
Do you think a DNA blood test for chromosomal syndromes is accurate than amniocentesis?
Amniocentesis, no, 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 please.
So
Oban,
was someone saying something?
I'm not.
no,
Yeah.
Dr. Kojo, go on.
Okay.
I wanted to explain it, but since you are there.
Thank
I'll just say what I had to say, then you can probably actually come in and then. So when it comes to, I think you're talking about the NIPT, that's a non-invasive prenatal testing. It is known to be accurate for testing some of these chromosomal conditions, but I think from what I remember, it's not a definitive diagnostic test. And like you mentioned, a diagnostic test like your synthesis is required for confirmation. That is what I remember. So I think that one directly, it analyzes fetal cells for a definitive yes or no, and is considered as the gold standard as far as I remember. So yep. I don't know whether you are asking then do you think a DNA blood test? So the amniocentesis is the gold standard. That is, yeah. I don't know if I've answered your question, but I don't know what Auntie Emma wanted to add to it.
I think what it's every test is not 100% accurate, but especially when it comes to sickle cell, when they between I think the 10th or the 10 to 12 weeks, most of it are accurate. But again, test in your test are accurate. They will do further testing. Again, it depends on what they are testing for. And one thing I would say, when the test, when you are requested to go and do it, and I think it is best, especially when it comes to sickle cell. I have come across things which could have been avoided, which a Ghanaian couple had lovely, nice 2 girls, and when the woman came in, she was AS. Nikunu saw your AA because of your Ghana, and both babies were SS, and it was really a big thing, the men, if it's compulsory say obi a wonyuma because of enema bi ekokoso nti na obi a wonyuma ye test for sickle na ya but until they say do any frame amonko, even the partners no, so why you cry wo baby a recheck it again, because it's not just once. I've come across a lot of the man will say me AA yanko check here AS mamni so AS, and I would say 9 out of 10 the babies end up having SS. And say what SSR, if you know the implications, it's not that easy. It puts a lot of pressure on the family. I won't say just a banner, because it affects everyone in the internet. So what is to crowd baby no one backroom her now or you're in your near Casabia Coco ya Miss Remo. Just recheck it again. Not less accurate that's a so won't terminate here. No one will terminate it, because the effect, I will say this, I have quite a few people woman who SSR, it's not easy. Maybe I worry in a good, because one cannot create and share many money. I will just say please, when you are requested to go and do any test, no, please try as much as possible. Test the keke and yet the last say. Thank you.
Thank you very much, everyone. I saw amniocentesis is what the test. Have we lost Dr. Kojo? Dr. Kojo, you're here. Sorry, I was just asking. Sorry, I didn't quite catch
Amniocentesis.
Amniocentesis. Thank you. Did you say that's the gold standard, the test?
As far as I remember, I don't know. The other ones, I think Dr. Mustafa wants to say something about.
Oh yeah, no.
What happens is that they go straight into the amniotic fluid, and then they take a sample. That's what they actually testing. You understand?
Amniocentesis. Excellent. We've learned something. You guys are testing this my doctorate too. But anyway, we'll get there. We thank God. Thank you guys.
And you see the way you see the way Dr. Akos pronounce it.
Amniocentesis.
Where I'm coming from, like we have different ways that we pronounce it. So please feel free. Those who don't know, just feel free.
I didn't know, this is my first time as well. I was just thinking, but yes, thank you, Akosia, for the English lesson as well. They are polluting the accent. I'm just but what was I gonna say? Dr. Mustafa, please.
First of all, I cannot help you with amniocentesis.
That is how we learned it.
And you have never be
Go for much no want to brofo.
Masa, any cephalosporins, then I say forget. Yeah, kunkuru kuru for
Guru
you.
bongo.
Okay, anyways. Um, I didn't want to talk about that because for me, I don't really have a lot of knowledge in that. I only answer it during MCQ and I pass my exams and I'm gone far away. Anything gynae, putting needles in children, I just know the word, I know what it means, and my past exams on Anameko. Now, what I just wanted to add to it is I think I just want to join the voice of every doctor around the world to actually debunk what our favorite friend Trump is saying. Please, Trump is not an expert in medical knowledge. He's not an expert in science at all. So anything he says at all, take it with a pinch of salt. The man said that you should use parazole, you should use detergent during the COVID time. You should drink some detergent, wash your nose with some detergent, and the virus will not get to you. It is, I think, my mother who said I should even use shea butter for my nose so that the virus doesn't get to me was even a better option than what Trump was saying. So please, whatever he's saying, there is no evidence at all. Yare deɛ yɛ nyame na ɛma, especially when it comes to these chromosomal diseases, genetic diseases. Up till now, we do not have clear causes of them. So some of these autistic stuffs, still researches are going on, and the thing we really need to focus on is when it comes to pregnancy and you go to a doctor and you need a pain relief, he will give you paracetamol because so far that is the safest thing. And the guy literally said during this interview that, I mean, his address to the UN, that it is Dr. Trump that is the treatment to autism. So, Ms. Remo, anything that he says that is scientific, don't take at all. It is actually a little bomb that is actually coming into your heart. So that's it. And the second thing was, I think this topic is quite interesting because in the practice we treat women with a variety of diseases, and I think pelvic floor exercise and health actually runs throughout your whole life. I mean, from adulthood to menopause. I think my Auntie Comfort said something I really liked here, which was we see a lot of women. I have to refer a lot of women to the gynecologist, especially people in their menopausal ages, because they are having leakages. When we talk about leakages, we just mean that the urine is just coming out without control. So they have to be wearing pampers here and there. So they go to the gynecologist. First, the urogynecologist, the first thing they do, go do physiotherapy, which is doing some pelvic floor exercise. If it doesn't work, then they consider some minor surgeries or even sometimes injections of steroids. So injections of estrogen and so on. So the most important thing that you can do now is to exercise your pelvic floor. It helps you in pregnancy, it improves your sexual life, and it actually takes you away from a lot of diseases in the future. The thing I want to add is the vagina is a muscle. So the more you gym it, the more it is stronger, the more there is a constriction, and the more you and your partner would enjoy. The penis as well is also, it has a muscular feature and the same way. So pelvic floor exercise is important throughout our life. Thank you very much.
Thank you, Dr. Mustafa. Honestly, when you raised your hands, I thought you were going to contest the friend assigned, what's it called? The fibroids that I assigned to you. So I'm glad you didn't contest it. It means you have accepted
Again,
in principle.
that
You have
guy you more
accepted in
again for
principle.
pass.
No, in
If it comes
principle.
to
So we will see.
gynecology, we just learned to pass. So we have passed. We are now doctors. Gynecology, anything. Actually, I would really love if someone can do fibroid
Okay,
because
fine.
fibroid is I mean, so Kojo Medasi, thanks for accepting the offer. Any other topic, I'll be. If you want, I can come and do acid-base balance.
So we've got a topic. I've got a topic that's been suggested, which is handling miscarriages. I think Dr. Mustafa, you can take that one, or that one to is Kojo's.
Yes, psychic crack. I can
Let
play
the
my way around.
specialist take the specialist. Why are you trying to
Thank
allocate to other
you.
people?
No,
Thank
wait, but
you.
Kojo
handling
take.
miscarriage. Oh, wait, hold on. That is Dr. Kojo's. You are right.
Yes, it is all his own.
And then Dr. Kojo, you have a lot because there's been a suggestion here to talk about handling miscarriages, which is also a very sensitive topic. So yes. Okay, then Dr. Kojo, that's a lot you have on your plate. It means we'll be seeing Dr. Kojo more often. Thank you. Thank you. Excellent. So we'll put all of those in train. And the doctors, the family doctors that are trying to avoid, don't worry, we'll get topics for them as well. So we'll see them here as well.
Me pacho ya mama Dr. Mustafa BY me pamucho.
Oh, no problem. Auntie Emma, don't worry.
He's coming
We're
very
working on it. No problem.
Onunko ande mu overloading mama.
Okay, no issues at all. Okay, so we've got two questions here. Should one be concerned if they're having a wee every 2 hours?
Dr. Mustafa and Dr. Akos. The family doctors, and I think they should come and then.
Me pacho me nye family doctor, but me can say yes. So we can go check again. There are some medications a weakened bladder. No, one of it, Doctor Akos, se me mechanocra pregabalin. If you're on pregabalin, we kill with bladder, and I think some strong pain relief. And say every 2 hours. So nasa won't do no monsieur bebria, and I won't for watermelon to say, yeah, doctor. Kojoka and Nadia, and I think it is wise to go and see your GP. No share on your further test to just find out what is going on.
Where there is our deal fala. This I can
Dr. Mustafa, go ahead.
Anyways, I think what she said is perfectly right. If you are weighing too much, it's a variety of disease depending on your age. It can even be that you are having a heart failure. It can even be a start of hypertension. It can be diabetes. It can be other hormonal diseases. It can be a hyperactive bladder. So the best thing is actually to go and do a blood test, rule out all the dangerous things. And if it's a hyperactive bladder or something, you will be given the necessary medication. So it ranges through a lot of things, but the most dangerous ones are actually the things that can cause systemic diseases like diabetes, like heart failure, like hypertension. Those ones are the things that you are more worried about. So you start with that, and then after that, they will do the additional diagnostic methods. But you should go and check it out.
Oh,
I just
Dr.
wanted to.
Mustafa, I forgot to I add this to it. Say I'm not doping. When people are on I'm not doping. Emma won't just on them. That's one of the
Auntie Ama,
medications.
the medication, sorry, I don't agree with you. Auntie Anamika, so amlodipine and pregabalin are not known to cause bladder problems. Ka can diuretics are fine. Pregabalin, there's some very rare cases that it happens, but it's not common side effect. And amlodipine is not one that causes, but diuretics, so things like bendraflumethiazide, furosemide, spironolactone, yeah, those ones cause urinary problems. But I think so the ones that you're mentioning, no, is I'm not very sure. And yeah, I just want us to maybe let's not mention those to scare people just now until we have enough information. But definitely I don't think pregabalin causes bladder issues. Definitely.
Can I ask you a question, doctor? Because you mentioned medication be there. Who said benzodine?
Bendraflumethiazide.
This is something you prescribe for people.
It's a blood pressure medication.
So I think one of the reasons why I don't really like talking about medications is because someone can actually go and see their doctor and then they'll be arguing. And also, if you do mention some medication, some people might want to get it on their own when you don't. That's why I normally don't touch on medications at all. Else, we've had issues like that in the past. So I try as much as possible to stay away from medications as soon as possible. Because someone can ask you, what can I take? And this or that. I don't subscribe to that because you really don't know the full history of the person and then all. So yeah, I want to be a quite.
So I do want to ask a question to you doctors, all of you doctors, as you prescribe these fantastic medications for people. Do you have problems, issues with patients struggling to mention some of these or remembering to mention? I mean, prescriptions I have them written there, and there like multiple or a few medications that start with Bendro, and would that cause any confusion if you
Yeah,
just go in and say Bendro?
yeah. When you say we even have a name that is a medication that's named after Tema
I see.
Temazepam. It's also there.
The anti-comfort, I was just surprised because these names are they're quite, they're quite hectic. I'm just wondering how people can remember their medications. But
Dr. Abuna, your eyebrows have been jumping on your face.
I always get surprised the amount of knowledge I get from this show. It's amazing. But thank you so much, doctors. You think you know, and you see, as I have, direct medical links, but here I am. I lack a lot of knowledge, but this is great. Thank you guys very much. I love this show.
Just to tell you, one of my best moments is always when the an old woman comes to you and she's like, um, the medication that I had, the blue small tablet, and you're like, okay. So, in general, a lot of people don't remember the name of the medication. So, um, I think it's not a big problem. The most important thing is, what does the medication do? I mean, that's where we start. And then after that, if you tell us you have that little blue medication, it makes me sleep better, probably you can give an idea. But other than that, yeah.
Let's see. Well, that's great. Anyway, that's that's good. I think. Oh yeah, there's one last question in here. Can three C-sections have an effect on your bladder later on in life?
Three, as in three. Anyway, multiple.
Having three C-sections.
Yeah, I mean, multiple C-section can increase bladder issues. These are due to formation of scar tissue, which are coadhesions, and I think a cumulative of what's it called? If cumulative effect of multiple what's it called surgical incisions to they they increase the risk of bladder injuries during the surgery itself or lead to symptoms like what's it called? Frequent urination and incontinence due to those scar tissues attachment. So yes, they can cause issues.
Okay. Sorry, I'm just reading off something. Okay, that's great. Thank you, doctor. With just looking at the time is fast spent. I think there are no further questions. Uh, so I think we'll bring it to an end here, and we'll just take your sort of closing message. What is your message for all of us? Oh, yes, I did want to mention something. When Dr. Mustafa talked about the penis being having a muscle, or is it full muscle? I'm not sure. So how do you exercise the penis?
Dr. Mustafa,
Isn't that your area?
he came to mention, did you hear me saying
I
anything?
just thought I would ask me. So how do you exercise the
I
penis and
think I
keep it
already
strong?
mentioned it. It's important for men to do like never skip leg day, what we call leg day. Try as much as possible to do lower body exercise just to improve your blood flow because that's the penis needs blood. It doesn't need alcohol. It doesn't need smoking. It doesn't need all these things that we whatever. Hey, Dr. Abra.
Oh, article for say I'm asking for the gentleman. We know about we
They are
focus
not
a
asking.
lot.
Why are you asking for
We
them?
focus a lot on women and the we know the vagina is a muscle. So, but today I was not surprised. I learned something new that the penis is also a muscle, and I just wondered, there's particular things you can do to exercise the penis, but yeah, great. Okay. Thank you. Thank you, doctor. So like I was saying, your sort of closing statement to us about Kegel health.
All right. Don't wait for the problem to start. Start exercising now. Do your squat at home. Try as much as possible to. What you can do is just go on YouTube and then just type pelvic floor exercises, and then you see lots of them and how they do it. It's very easy. It doesn't take much of your time. You can be doing that at home or wherever that you want to do it. And also, very important, the sexual health. Do exercise to improve your sexual life. It is very, very important. Tomorrow is Thursday, Friday is there. Normally, people do their things on Friday. So start gymming today, start exercising today, and then have a very good session on Friday night. Thank you.
Doctor, you've mentioned gym a lot, so I think at some point we'll get you back on here to talk about the benefits of health benefits as a doctor, your perspective of gym.
I'll hand that over to you. Thank you.
Oh, me.
Yeah.
No, but we need, okay, we'll talk about it behind closed doors. So we'll discuss something.
Yeah.
Because I think, no, because you mentioned you're very big on obviously the gym.
Exercise is
And
good.
the gym is very, I wouldn't say it's controversial. It's very popular now, but then there are a few people who also feel like gym is not necessarily like, there are some opinions. So it's great to link it to health medically and see. But anyway, thank you so much, Dr. Kojo. It was lovely to have you back on the show. And it seems like we'll be having you back on here a lot more often because you have a few topics you need to cover with us. So we'll be seeing you more often than not. Thank you to our faithful watchers for taking 2 hours out of your day each week to support this show and to be here and to be interactive, ask questions, and with your submissions as well. We really appreciate it. I was just going to say that since winter is now coming, if it's not work, then a lot of us will be indoors. So please do share the link so that please share the link so that on Wednesdays, the show can bless someone. In the summer, we know people have places to be and things to do, but winter's coming, so we are all going to be indoors. So please do share the link. Kindly bring a person on, and so for tomorrow, Dr. Kojo is having a double whammy. Dr. Kojo and Auntie Comfort will be on a time with Taptap Send. And just to be clear, let's just see what they'll be, just to get they'll be live on the show and they'll be talking about, oh, sorry, let's just get my stuff together.
Anti-comfort, really, I'm never having this question.
Maternal health care. So please, this is a show we cannot miss. So please make sure that you tune into a time with Taptap Send tomorrow.
Dr. Mume, Ben so haka.
Please tune into a time with Taptap Send tomorrow. That is a show you do not want to miss. Same time, same link, as you know. And then on Friday, we've got a time with the lawyer as well. So again, that it's so funny. I don't know if you guys have heard reform and what reform plans to do for the UK. Yeah, UK's immigration is constantly moving now. So it's good to just to know what potentially can come up and what and what is currently in train and what is currently happening, so that we all keep abreast and help our families in our friends. So please do join that as well. Okay, we have come to the end of the show, and just want to say a big thank you to everyone again. Once again, my name is Miss Abena. I was going to say Dr. Abena, Miss Abena, honorary doctor, as you can see. And I was joined here with Dr. Fisher today, and please do join the OT Media friends saying WhatsApp group, because that's where you get all the sort of like communicates about what's coming on and what's going on, what's coming on, what topics we're going to discuss, and all the different updates that you can get. You can also follow us